Hello everyone, we have moved on to the second week. This week, there are some situations similar to the first week, which we will briefly talk about. There are also new developments related to organ systems that we will discuss. We will give you some tips about your baby, and especially in certain situations, we will try to explain which position you should take or the possible reasons behind your baby's unclear behaviors. Now, in the second week, adaptation continues. By adaptation, we mean that both the mother and the baby are getting used to each other and to parenthood. This is also an adaptation to life outside the womb and to forming these adjustment mechanisms. In fact, a rhythm has started to form between you and your baby. You will begin to sense what your baby is trying to tell you in different situations. At the same time, you will start to recognize small signals of hunger and different types of crying. You are beginning to learn and understand what these signals really mean for your baby. Now, when the baby is about 10 days old, we move on to growth. From this point on, until the end of the month, your baby will continue to gain an average of 20 to 30 grams per day. By the end of the month, the baby should grow approximately 4 to 5 centimeters in length. Especially in the second week, because growth spurts occur, babies tend to be much more restless, more irritable, and much more inclined to suck. These post-feeding behaviors can make you feel like a full-time breastfeeding employee. You can accept feeling this way, but remember that this is a temporary period, and patience is especially important during this time. This period is sometimes referred to as postpartum blues or a mild sadness after pregnancy. During this time, you should be very careful about your relationships with people around you. So, what is happening in the body? Babies usually gain more awareness during this period. Swelling caused by birth trauma, such as swelling of the head and body, and skin rashes may be present. Eye swelling seen after birth starts to improve. While passing through the birth canal, some babies may develop redness or tension in the eyes. Now this is the healing phase. There are some important points to watch for in the second week. If there are new rashes, you should note them. Existing marks may darken and become more visible. This is called a strawberry hemangioma, which is a vascular condition, and you should inform your doctor about it during your visit. Your baby's brain development continues. Your baby cries to communicate problems, which may be due to hunger or discomfort. Your baby is starting to hear loud sounds, and these may trigger what is called the Moro reflex. This reflex should be present and should occur equally on both sides. Your baby is now starting to hold their head briefly and tries to look at you when you bring your face closer. Although these are normal baby behaviors, some findings may provide specific information. When you notice concerning signs, consult your doctor and do not forget to request further evaluation if necessary. If your baby does not respond to loud sounds and a newborn hearing screening has not been done, consult your doctor again. If your baby seems to be in pain, is difficult to wake, or if you hear a cry that sounds different from normal, do not hesitate to consult a doctor. Your baby's day-night sleep pattern is related to the melatonin hormone, which we call the circadian rhythm. A clear wakefulness rhythm has not yet been established. At this stage, there is no need to reorganize it, because feeding will continue every 2 to 3 hours. Although babies continue to sleep about 18 hours a day, your baby is more awake compared to the first week. We are in the second week, and your baby should be much more active, mobile, and strong. In this case, I can recommend using a baby carrier. This allows you to do your daily tasks while letting your baby stay in contact with you. Let your baby smell you and keep them close during activities. Try to be more attentive to the time you spend together. This may cause your baby to become more observant of you or the outside world, try to adapt to changing environments, and sometimes become a bit more unsettled. Gradually increase the amount of contact you have with your baby. The benefits of this contact include increased milk supply, faster maternal recovery, rapid establishment of shared flora, regulation of your baby's body temperature, and helping your baby pass the second week in a healthier way. A special situation in the second week is bathing, as the umbilical cord usually falls off. After it falls, you can start bathing as usual. The first encounter with bathing can be exciting, but not every baby enjoys it. If your baby likes it, that's wonderful. If not, don't worry. Give them time, and they will likely enjoy bathing more in the future. If you make it a daily routine and a playful experience, your baby's acceptance of bathing will increase and resistance will decrease. After the bath, using a natural oil such as almond oil or olive oil for massage can help your baby relax. Over time, you may unintentionally create a routine of feeding, bathing with massage, and sleep, helping your baby feel calm and eventually enjoy bath time. Here is an important note. Bathing your baby every day in all situations is not always appropriate. For most babies, bathing 1 to 3 times per week is sufficient. However, if your conditions and environment are suitable, you may do it daily. Now let's move on to umbilical cord care. The cord should be protected, because if it gets wet, falling off may be delayed. As we mentioned in the first week, it should be kept dry and clean. If there are no problems, the cord will fall off in a short time. Regarding diaper changes, meconium usually ends by the end of the first week, and stools turn yellow or green, what we call normal breast milk stool, which may be slightly seedy and usually odorless. Babies typically continue to have bowel movements about 3 times a day. If feeding is adequate, your baby should urinate 6 or more times per day. If you have difficulty noticing urine, there are specially designed diapers you can use, or you can place a tissue at the front of the diaper to check. Now let's talk about feeding. Your baby may spend 15 to 45 minutes feeding in sessions that can last up to an hour. Think of feeding every 2 to 3 hours, followed by care. After feeding, your baby may need to be put back to sleep within an hour and may wake again due to hunger. You may feel like a full-time breastfeeding employee, but patience is essential. I know there may be little time to rest, but as your baby grows and gains weight, they will wake less often, feed more efficiently, extend the intervals between feedings, and restore balance and routine. This low mood will also pass. Remember, your baby is 2 weeks old. You need to provide the nutrition your baby needs because they are going through a growth spurt and should gain an average of 20 to 30 grams per day until the end of the month, with a length increase of about 4 to 5 centimeters by then. During this period, to maintain rhythm, you should feed your baby by following hunger cues, before crying from hunger, by sensing when your baby is hungry or uncomfortable. If you feed your baby without letting them become overly hungry, this period will pass more smoothly and quickly. Babies who are left hungry may sometimes struggle to resume breastfeeding, which can prolong restlessness and increase maternal anxiety, potentially leading to a cycle that worsens mood and contributes to depression. Therefore, especially in the second week, if your baby cries without clearly being hungry, try to provide the needed amount without worry, before hunger escalates. Do not leave your baby hungry during the breastfeeding period. I will now give you some tips about typical hunger cues in breastfed babies. Regardless of how intense the crying is, these signs may be present. We recommend starting breastfeeding immediately, although your baby may not always respond the same way. Observe which signals your baby responds to and act accordingly. If your baby shows mild restlessness, moves their arms and legs while awake for no clear reason, starts sucking on their fist or fingers, smacks their lips or tongue, or turns their head from side to side, you should begin feeding. If your baby turns toward you while being held, looks toward your chest, tries to move, makes whimpering or sighing sounds, shows facial expressions, and moves restlessly, your baby is truly hungry. Do not ignore these hunger cues. Feed your baby. If you are using formula or expressed milk, continue in the same way you did during the first week, as previously discussed. Now let's move on to sleep. We said that babies continue to sleep 16 to 18 hours per day in the first week. Your baby is now stronger and taking in more nutrition, so they may wake more often. However, if the following conditions are met, you may allow your baby to sleep up to about 5 hours, but not longer. No jaundice, more than 3 bowel movements per day, and at least 6 urinations per day. In this case, you do not need to wake your baby every 2 to 3 hours to feed. In the first week, we advised not letting them sleep longer than 2 to 3 hours, but if these conditions are met in the second week and your baby is feeding well, allowing about 5 hours of sleep is acceptable. Regarding sleep, the American Academy of Pediatrics and most unbiased studies state that the safest place for your baby to sleep is in their own bed. Common mistakes include letting babies sleep in car seats, on soft couches, in your arms, or in swings because of fear they might wake up. This is not recommended. Do not be afraid of your baby waking. Put them to sleep in their own bed. As for health and safety during the week, we discussed routine checkups in the first week. After discharge, babies usually see a pediatrician within 2 to 5 days, and after the second heel prick blood test within the first week, they are taken to the family doctor. Routine follow-ups include weight monitoring, and unless your doctor calls you back, there is usually no need to return until 1 month of age. Measurements generally include weight, length, and head circumference, and feeding patterns are reviewed. We should not skip some safety points. Even if your baby can move their head slightly, do not leave them alone, as they can easily slip or move and fall. Remember that your baby's immune system is not fully developed, so try to minimize exposure to germs. As much as we encourage going outside with your baby, try to limit visitors at home and wait a bit longer until your baby grows. Keep a thermometer at home, and for any temperature above 37.8 degrees Celsius, consult your doctor. Do not hesitate to seek medical advice if your baby has a fever, as fever is an important sign in newborns and must be managed according to specific standards. Measure temperature from the armpit or ear. Do not use infrared gun thermometers. They are not suitable for babies. If your baby shows signs of illness, such as fever, poor feeding, lethargy, or excessive irritability, consult your doctor. Postpartum sadness should start to resolve during this period, but postpartum depression can also occur. If you feel depressed or unsettled, do not hesitate to talk to people close to you, especially your partner and loved ones, and seek help from your doctor. If you are breastfeeding, consult your doctor if you have concerns. We mentioned that milk supply may not be sufficient from the first week up to around day 10. Because your baby is going through a growth spurt, some issues may arise, increasing milk demand. If there are errors in breastfeeding technique, milk supply issues may occur, and you may feel pain during breastfeeding, which can lead to cracks or bleeding and cause reluctance to breastfeed. In such cases, consult your doctor, nurse, or a lactation consultant. One common issue is mastitis, or breast inflammation, often related to nipple problems or milk engorgement. It may occur when breasts are not emptied sufficiently. Symptoms can include tenderness, redness, fatigue, or fever. What should you do? You can take pain relievers such as ibuprofen, apply warm compresses, massage the area, and increase feeding frequency to empty the breast more effectively. If symptoms do not improve or infection is suspected, consult a doctor, and antibiotics may be required. Postpartum complications should be addressed with medical guidance and, if necessary, a second opinion. As we mentioned before, although this is considered a recovery week, improvement may not always be evident, so be especially careful during the second week. If you had a cesarean section and notice redness at the incision, fever, foul odor, discharge, swelling, or tenderness, consult your doctor. This can occur up to the 6th week. Although light bleeding can be normal, heavy bleeding, clots, large clots, persistent bleeding, foul odor, or increasing pain are not normal and should prompt medical evaluation. To conclude, this is a very special period. Both of you are gradually healing, your baby and yourself. Your awareness is increasing, your mutual responses and harmony are developing, new discoveries are beginning, and learning is at its peak. Avoid overly strenuous activities. Extreme ideas or activities are not appropriate, but you can start doing things you enjoy at a moderate level. If your sleep-wake rhythm is still disrupted due to circadian rhythm and melatonin fluctuations, and if you have severe pain or bleeding, try to adapt to your own sleep pattern. Seek help if there are feeding issues. Continuous feeding is normal during this period and is temporary, so patience is key. If your baby has 3 or more bowel movements and 6 or more urinations per day, especially in the second week, you are on the right track. Hormonal changes and emotional shifts related to postpartum blues or postpartum depression can affect your mood. Do not hesitate to inform your relatives and seek support. We have completed another week, and soon I will present the 3-week evaluation. I have simplified the topics and sentences as much as possible, compiling information from the American Academy of Pediatrics, postgraduate textbooks, and recent studies, aiming to provide understandable, reassuring guidance for mothers and to show that this process, while challenging, is manageable. If you like the video and subscribe at the end, I would really appreciate it. Take care of yourselves. Goodbye.